There's a lot of confusion often with the titles. And so in Canada, we're calling this at this point physician-assisted dying. This encompasses two things. One is physician-assisted suicide. That would be giving a patient a large dose of medication that he or she will take when they can no longer endure the suffering that they're in. So the physician is assisting the patient in their suicide. The second one is euthanasia, in which the physician's taking a direct action, such as inserting an IV line in which, something lethal would be run through it to end the life. So physician-assisted dying encompasses both those things. So in Canada, we have now, there's a lot of changes going on, but Canada's at a turning point. We are just beginning the process of physician-assisted dying. But I want to be very clear here. What is completely clear under the laws of Canada and the health and healthcare practice of all of its provinces and territories is anyone who is uncomfortable with this for personal, cultural, religious reasons does not have to have anything to do with it at all. So there's some confusion on that. Will healthcare workers all have to be involved with this? And the answer is absolutely not. The one expectation is that if a person is working with a patient, a healthcare worker is working with a patient, and the patient has questions about physician-assisted dying, that if you're not able or willing to talk to them about it, that you would find someone for them to have the conversation with. That's all it is. No one is being forced to be involved in this. And yes, it's very controversial, and Canada's making a very bold forward step on this. But by late 2016, it will be very much in practice throughout the country. When we look to the American data, now it's not as if all of the United States has this, but a few of their states do have it. And by it, they actually have physician-assisted suicide. The numbers tend to remain very limited, quite small, and it's associated with palliative care. When we look to the European countries that have it, Netherlands, Belgium, Luxembourg, the numbers also remain quite small. There's no indication that Canada will ever have high numbers. And do remember that research tells us that the average person that asks for physician-assisted dying and is granted that chooses not to. They decide they want to take it day by day, but there's a huge psychological benefit to them knowing that if they find it unbearable, that they have an option. So that is what we're looking at. We'll know a lot more in the time ahead, but it does not look like it'll be significant numbers. The average Canadian healthcare worker will not be directly involved with this, and we'll see over time. But it's going to be tough. It's going to be controversial. Some people think it's long overdue, and others feel it really doesn't feel right to them, and they don't want to be a part of it. And we all need to get along. But the law has clearly changed in Canada. I'm cautiously supportive of physician-assisted dying. I feel that patients have a right to say that they've had enough. They have a right to say, yes, you're offering me these treatments, and I don't want them. I feel that my suffering is unbearable. I do believe that. I worry a great deal about vulnerability. I worry about a person that's experiencing pain, a disability, and maybe there's a secondary concern that they're worried that their family isn't able to work because they have to take care of them, that in fact they're making the decision not so much because they want physician-assisted dying, but because they're worried about being a burden to other people or that they're isolated. So there's a lot of social factors that we have to look at very carefully as a society. So I worry about vulnerability and I worry about the elderly, and I think we have to move cautiously. But I must say, from an ethical point of view, I think the country is making the right decision by moving forward on this. I simply, if we believe in patient rights and autonomy, it's a very hard position to say that you must endure, enormous amounts of suffering and pain that you do not want to. And I think it is the right thing for the country to do. It will never be immediate. There will always be an assessment period, and we don't know all the legal details as yet, but there will almost certainly be at least 2 physicians involved. The timeline may vary because some of the cancers can be very aggressive and painful, so there may be exceptions as to how long the timeline is, but it will be carefully assessed. Well, I think it will benefit people with very aggressive, painful cancers and maybe diseases like ALS. But, we need to be clear, the Canadian legislation does not say that you need to be, the Canadian, what the Supreme Court of Canada has said is you actually don't have to be dying of anything. It has to be grievous and irremediable. Two words that are neither of which are medical words at all. And so we know that grievous means very serious and irremediable means you can't fix it. But to answer your question, I mean, that's very, very broad indeed. And this is one of the reasons why it's so controversial in Canada. It's the breadth of what that could mean. And so clearly that would include aggressive metastasizing cancers, ALS, but it could include a lot of other longer-term difficult chronic conditions. And it does not exclude mental health. So if a person feels that they are suffering from a mental health challenge, a problem, diagnosis, and that it's grievous and irremediable, they would be in a position to apply. As long as they're capable, of course, the person has to be capable. Quebec was the first province in the country, and they went forward and created their own legislation. What's very different is Quebec, in fact, you do need to be dying of a condition. You need to have a terminal condition in Quebec. Secondly, it's my strongest understanding that it excludes mental health, and so it could not be a psychiatric disorder. And the Canadian legislation, although I shouldn't say legislation, the Supreme Court ruling, we are waiting for legislation in June of 2016, is much broader, in which it needs to be grievous and irremediable, with unbearable suffering. But that does not exclude a lot of things. So in a lot of ways, Quebec is narrower, and the national standard is broader. This could bring challenges ahead. What's incredibly important and what has come to light recently is that even the term is now under question, physician-assisted dying, because although physicians may do it, it involves large teams of healthcare workers that would include pharmacy, nursing, social workers could be involved. There's a whole range of people that may well be involved. And by involved, I don't mean actively ending a person's life, but certainly in conversations and counseling and all of these types of things. So absolutely all of the colleges need to sort this out and take positions. There's quite a wait and see mentality going on in Canada. I'm not sure that's very clever because the legislation may be broad and it still may not answer every question, and I think we need to be prepared institutionally and in terms of colleges as well. The one thing I would say about the specific topic of physician-assisted dying is as Canadian healthcare workers, we have to find our way forward. We have to get along. There's no question we're going to be co-working with people that have different opinions than we do on this topic, and we have to work in teams, and we have to be absolutely respectful, whether people are supportive or non-supportive, and we need to continue to work together no matter what a person's position is on this.